Welcome to this session presented by Mrs. Prudence Hamilton. Medical devices are those things that we use in most cases during procedures, after diagnosis, or after giving treatments to our patients. So today we shall be looking at how safely can we manage those medical devices after using them or even before using them. So medical devices are instruments, appliances, or equipments used for medical purpose, including diagnosis, monitoring, and treating disease or physical impairment. So basically, we shall be looking at instruments and how we can manage them. So first and foremost, let's look at how we can safely handle safe handling of sharps. So use aseptic techniques during all invasive procedures, including injection, to prevent transmission of infection. So follow proper hand hygiene, use sterile needles, syringe, and dispose of safely. So when you look at this safe handling of sharps, we want to make sure that any invasive procedure they are handled safely or they are managed safely. So sharps such as needles, scapules pose a significant risk to injury and infection transmission. So it might, in most cases, it will just be like an injury, a accident, let me say. You actually did not intend to break yourself, you did not intend to break the patient, but you should practice how safely to handle sharps. So one thing that can help you to handle sharps without injuring yourself is by avoiding recapping. If you must recap, then you can always put the cap on the table. Then after you've finished your injection, then you recap while it is on the table. You're not holding it in your hands. By doing that, you're able to reduce the risk of getting injury from the same needles. Then use safety engineered device to minimize the risk of needle stick injuries. Dispose of sharps in puncture resistant containers immediately after use. So another way to help you prevent this risk of injury from the sharps or the needles is immediately after you have injected, you can drop off in the, we call it safety box. Others, they call it puncture resistant containers. If you don't have the safety box that you are able to carry around, that's when you can use the puncture resistant containers. So we go to the next one, which is safe handling and disposal of waste. So here we are looking at basically proper segregation, containment, and disposal of health care waste. They are very crucial to prevent spread of infection. So as we shall be looking at these guidelines, we have local guidelines and regulation for waste management, especially healthcare waste, that ensures that there is appropriate leveling and disposal. As you're seeing from this presentation, we have different containers which has different meanings on them. So let's look at them in the next slide. Waste segregation of solid biomedical waste. So as we can see, we have been looking at all these containers in all corners of the hospital according to their level of infection. So the black container is the one which is usually non-infectious. I think we see it's the one most people use for putting rubbish, including even patients. So that is, it carries it. If you see a black container, it's for plastic containers or containers which are not infectious. So non-infected waste can be disposed in the black containers, but make sure that you secure it inside these containers. Let it have a cavera which is lining inside so that it's easy to dispose of. But when we look at these other black containers, we can use some of the waste that they have put there to, we can recycle them and still use them again since they are non-infected. So we go to the red bin. So the red bin in most cases is for solid waste and is highly infectious. So when you get rubbish or when you get waste from the red bin, it's either you bury them or you're supposed to autoclave, or you first autoclave then you go and bury them because they are highly infectious waste. So those waste could be like infected dressing. We have those pop casts, anything that contains blood is highly infectious. Then we go to the yellow bin. The yellow bin is for carrying like anatomical waste like placenta, pathology waste or body parts, which is not the case when you come to labor suit. So the yellow bin is also infectious. When you get waste from inside, it should be buried. Then we go to the blue bin. Blue bin is having infected syringe, gloves, and those other plastic wastes. So some of this, it's not very infectious. It's not as infectious as that of the red bin. So some of these things in the blue bin can be recycled and reused, but after disinfecting with at least 1% chlorine. Then we have the white one, which is the sharps container. So the sharps container is rarely seen in most cases because we use the sharps box. So if you happen to find a white bin in your setting, that is for putting sharps. Those are needles, the cut glasses, anything which is very sharp, we can put it in the white bin. So that is how you segregate your waste when you are in the hospital. Don't mix all of them together. So we have safe handling of medical waste. Safe handling of medical waste include those medical waste include like contaminated blood, body fluids, and any other potential infectious materials. So proper handling of this waste are crucial to prevent spread of infection and protect health workers, patients, and the environment. So if we properly handle these other medical waste, we are protecting ourselves, we are protecting the patients, and also our environment. Remember, we said infection prevention control is one of the crucial parts of primary health care. So when we talk of primary health care, we are looking at the environment itself. So we have active protection of environment in waste management. So as we are looking at our safe management of medical devices, you should put at the back of your mind that we should also protect the environment from these other medical waste. So healthcare facilities should implement proper waste management practice to protect the environment. So it's not advisable for you to keep throwing your, let's say, for example, you have a small clinic and you just throw outside, maybe in front of your clinic or at the back of your clinic, all those used gloves, the stained cotton, or maybe the cotton which has been soaked with pus, or maybe you're throwing away those syringes just at the back there. So it's important that you manage your waste because it helps to protect the environment from those other infections. So this includes segregation, recycling, appropriate treatment of medical waste. So make sure that everything you use within your setting is segregated appropriately and also disposed appropriately to make sure that the environment is safe. So we have what is called waste management hierarchy. So waste management hierarchy emphasizes on reducing, reusing, and recycling of waste as preferred strategies of over disposal. So these days we are looking at how best can we reduce the contamination in the environment because of medical waste. So if there are things that we can reuse, we segregate them and they undergo procedures which are required so that it can be recycled and again reused. So healthcare facilities should strive to minimize waste generation and maximize healthy environment of environment friendly practice. So this helps us to reduce the those other infections around the environment. We have types of medical waste. So medical waste have been categorized into different types. One, we have sharps waste, which include the needles, the syringe, the lancets. We have other sharp objects. So anything which is sharp should be disposed in a puncture-resistant container, which is well labeled. Then we have pathological waste. Pathological waste refers to those other tissues which have been cut from the body. Tissues, organs, body parts removed during surgery, including those other ones of autopsy, or even the one for circumcision. We can even talk of cords and placenta. All those ones are pathological waste. So it should be properly sealed and labeled for appropriate disposal. We have infectious waste. Infectious waste consists of items contaminated with blood and other potential infectious materials. So for it should be segregated and double bagged and labeled for disposal. So these other infectious wastes, if you get them, you should put them in another polythene bag, then label and keep it aside or very far from reach. Then we have pharmaceuticals, pharmaceutical waste. These include expired or unused medications or pharmaceutical products. So sometimes we have drugs which are getting expired, or they are not being used in the hospital, so we can dispose them also separately. So this one, proper disposal method should be followed to prevent accidental ingestion and environmental contamination. So sometimes in the health, especially smaller settings like clinics, you find we dispose of those expired drugs just outside our clinics, not knowing someone can actually ingest it without seeing the expiry date. So we have chemical waste. Chemical waste comprises of hazardous substance such as disinfectants, solvents, and those laboratory chemicals. So just like its name, it should be disposed according to specific guidelines and regulations. So we cannot dispose chemical waste where we are disposing our solid wastes, because these ones are mostly liquid in form and some solids also. So proper waste segregation should have healthcare facilities should have a system in place for proper waste segregation to ensure that they should ensure there are different types of wastes which are appropriately handled and disposed of. So you cannot, let's say, for example, you are a midwife, you want to start a maternity home, but you do not have a placenta pit. Where will you dispose of those placentas? So it's important that these things are handled in a better way. Then we have recycling and waste reduction. So recycling and waste reduction is also under safe management. By recycling programs should be implemented to reduce waste generation and minimize environmental impacts. So we are already seeing that those other non-infectious wastes are the one that we are going to recycle. So as we plan to recycle them, we should also segregate them appropriately, not mix them with the ones which are highly infectious. So reusable items such as containers, packings should be encouraged whenever possible. So appropriate treatment methods. Medical waste should undergo appropriate treatment methods such as incineration, autoclaving, and clinical treatments. So all those other equipments that you are going to be using, they should be treated well for next use. Others can be put in the incinerator, others can be put in chemical treatment, especially the ones which they're highly infectious. So treatment should be performed following local regulations and guidelines. As we can see from the picture there, we are having an incinerator and we are having a autoclave. So in the autoclaves, most times they are sterilizing. Promoting sustainability in waste management. So healthcare facilities should adopt sustainable waste management practice, including reducing waste generation. So this waste generation, for example, let me say a mother has come to the hospital with a labor-like pain. We know that we are supposed to examine these people at least 4 hourly. That's when you should do the next vaginal examination. So you find that sometimes those people do not really know, they don't follow time, they go and move for like 30 minutes and they want to come back to be re-examined. So we want to reduce waste segregation by making sure that we are not using too many gloves, let's say in the maternity. You use gloves when you are supposed to use, because we find that somebody will put on gloves and move around without doing anything and remove the glove. That is it's not a good way of generating waste. So we should reduce waste generation. We put on gloves only when you need to examine a patient or when you need to do an assessment. Then after you remove. Not even, some people put on gloves, you'll find them, they're writing in the maternity book, but they're using gloves. That is a bad practice. So thank you so much for attending this session of safe management of medical devices. I hope we shall be able to manage and segregate our wastes to avoid or to reduce infection, especially from the environment. Thank you.